completely. But we are here because of the work of our next guest. It has been an incredible relationship that the Diabetes Network, the whole state of diabetes, not the Kentucky Diabetes Network, but the network of people in the state that do diabetes work. We have so much to do to thank our next speaker. Jenny Goins is the acting commissioner. By the way, I'm the deputy commissioner. Bob always puts me as the commissioner of public health. My stepdaughter calls me the czarina of public health, which I kind of like and wish I could, wave my wand and whack things around and get them done. But I am the deputy commissioner. Jenny is the acting commissioner for the Kentucky Employee Health Plan. That's in the personnel cabinet, and it's in the Department for Employee Insurance. And as I said, 265,000 covered lives. So that's your school teachers, all your state health workers, and she'll, I'm sure, go into that in more detail. Before coming to the state, Commissioner Goins was in the United States Air Force and the Air National Guard. She was a Chief Master Sergeant and retired as a Chief Master Sergeant. She was there for 25 years. In her last 10 years, she spent her time teaching leadership skills and communication skills. She then went to the corporate world for 10 years, where she worked in organizational development and managing and was a senior HR leader. In 2015, she was inducted into the Kentucky Military Hall of Fame. She has an undergraduate degree in organizational management. She has a master's degree in adult learning, and I love this because I can identify with this. She lives on the Kentucky River with her husband, as I do, except she has a dog, Darby, who likes to swim in the river because Darby thinks that that's her own private swimming pool. So we are so grateful for Commissioner Goins' 7 years as the deputy commissioner of this department, and now the acting commissioner, and we are very excited to hear what she has to say today and give her our own personal thank you for all of this.
Thank you, Dr. White. I have a pretty loud mouth. I'll try to stand here at the podium, but I'm really kind of used to walking around, but I guess I probably need to stay here. And I'm very short. I did a presentation recently. I had to ask the audience if they could even see me over the podium. So hopefully you can see me. I'm very honored to be here. And in some ways, I feel a little strange to get to be the person talking to you, because Joe Pauls, a few years ago, started us on this mission with the vision of really partnering with Cabinet for Health and Family Services. We had a Senate bill that made us do it, but really the passion that was put into it and the effort that was put into it was because we wanted to do it. And actually, we were having a meeting internally this morning about our role in that process. So very excited to be here to share our successes. And some of you in this room are probably a very big part of that. Anyone in this room a Kentucky Employees Health Plan member? Okay, so quite a few of you are also our members. I'm glad to see that. As I go through here, what I want to do is really give you an overview of our program, talk about the milestones that got us where we are, look at our results, and then talk about the future, because I stepped outside for a second after Bob Badge's great speech, and he asked, "Are you guys going to continue?" And it's like, yes. Why would we not? We're going to continue. We're going to try to continue to grow, and I'll talk about that a little bit also. So a little bit about who we are. Some of you know this. We're a self-insured plan, and we've been self-insured since 2006. As Dr. White said, we have 265,000 our members. 171 of those are our employees, retirees, etc. We're a $1 billion plan, $1.5 billion plan. So we are pretty large. We're actually the largest plan in Kentucky. So, when you think about the members that we cover in the 120 counties of Kentucky, we touch every one of those counties. And you can see how we're broken up. We have the school boards that were mentioned, early retirees, those who are lucky enough to go ahead and retire before they reach age 65, so maybe somewhere between 45 to 65, they're on our plan. The state agencies, most people think state agencies are our biggest consumer or member of the plan, and actually it's the school boards, as you can see. And then quasi-agencies are those local government agencies such as fire departments. I mean, we have some fire departments where we may have 2 employees on our plan, really small agencies that choose to join our plan. So how did we get here with this diabetes prevention program? What are some things that put us in this direction? Well, we had a 3-year strategy starting, we started the conversations in 2012 and in 2013, but the 3-year strategy was we really needed to focus on wellness. It's no fun being at the bottom of that list when it talks about the states who are the healthiest, and we're not very near the top of that, are we? You guys know that better than I do. But we realized what we wanted to do was really introduce a voluntary wellness plan, and Humana Vitality is our partner, was our partner then and is still our partner. One of the key things that Humana Vitality brings to us is an incentive program. We learned very quickly, we had a project with Virgin Health Miles. Didn't do great, it did okay, but we had about 12,000 people out of 265, or even the 171, who participated in Virgin Health Miles, and that was in about 2011. They didn't have incentives. Incentives are what get our folks involved, and Humana Vitality has the incentive. So with that program, we wanted to really increase, our strategy is to increase everyone's wellness efforts. And we also wanted to increase people's general health awareness through health assessments, through biometric screenings. And we've had story after story of people going to get their biometric screening and immediately sometimes being taken straight to the doctor or being told you need to see the doctor immediately because they had not been getting their preventive care. And they had extremely high blood pressure at stroke level, or really high numbers related to heart disease, really high numbers related to diabetes that they needed to be seen. So that was our goal. But we also needed to create plan designs that helped people understand consumer-driven health plans. At that time, before we started down the road in 2014 of offering multiple consumer-driven health plans, we had the maximum choice plan. I don't know if anyone in the room was ever on that, but that was our foray into consumer-driven healthcare. But we really realized that we really needed to do more with that, and we also needed to start an education program with our members to help them have more literacy around their health insurance cost. Because just because you go to the doctor and have a copay of $25, that's not what it costs, is it? And you guys all know that. So we were able to do that and look at increasing health insurance literacy. Another way that we've partnered with Vitals, Smart Shopper. Has anyone shopped for coverage in here? Okay, you guys need to go to the KEHP.gov, KY.gov website and look up Vital Smart Shopper. That's another incentive program. Let's say you need to get your annual mammogram or a colonoscopy. Those, I didn't like my colonoscopy when I turned 50. But you can search and make sure you're going to a lower cost provider, saving yourself money, but it's covered at 100%. But you're also saving the plan money, and you get a check in the mail. How good is that? You don't like getting that colonoscopy anyway. And again, we've learned people are learning more about their cost related to health insurance through using a transparency program with incentives. So that's some history of us. The National Diabetes Prevention Program, I'm going to go through these slides fast because I know you guys probably know this better than I do. So it's based on a study that was done in 2002 by the National Institute of Health along with the CDC. And the key thing, I think, that keeps this program going more and more is its evidence-based lifestyle change program. So we really are paying attention to the numbers, to the metrics, and I'll share some of that with you when we talk about the milestones. So in that study, research showed that modest behavior changes, some increase in physical activity, 30 minutes, is it 3 or 5 times a week?
5.
I think it was 5, thank you. Just went blank there for a second. It helps with weight loss. Weight loss is going to help with you getting that BMI down, which is going to help with you. You might be pre-diabetic, but it helps stop that phase and doesn't transfer into being diabetic. And that's the program we've been focusing on. How do we keep all these members who are in these obese categories, or they have high A1C numbers, or their BMI is too high, how do we keep them from moving into that diabetic category? Because that's where we're going to save money. And you know, one of the things that I talk about a lot with our staff, with our leadership, with our vendors is, you know, we are a business. We're a self-insured health plan. We have to look at cost. We have to look at what we're doing. But we can't ever totally look at cost and forget the human side. And this is the human side of what we do, is looking at that, knowing we need to save cost, but we're really doing the right thing by our members. So in the DPP sessions, and I know we have several DPP instructors in the room, again, you guys know this better than me, but you're working with a lifestyle coach, you're meeting once a week for 16 weeks and then once a month for 6 to 8 months. And of course the goal is to lose weight and get more physically active, and then to manage your stress. All things that help push people into that diabetic category. So the CDC estimate is 1 in 3 of adult Americans have pre-diabetes. I did not see the sheet that Jim showed before I came. That's an excellent sheet. So I want to make sure I take that back and share it with our staff. Without intervention, 15 to 30% of those people with pre-diabetes will develop type 2 diabetes. And here, from a health plan perspective, is where the costs come in, and we want to avoid those costs. So I think I may have looked at the numbers wrong or had a typo here, because Dr. White mentioned that we were 3rd in the nation. So that's much better. That we're 3rd in the nation in the number of DPP recognized organization, but we're still 11th in the nation in the number of people who are eligible to participate in DPP. And we have a lot of those eligible people in our health plan. The percent weight loss over the last year, over a 12-month period, was 4.3%. Now this is overall Kentucky, this is not the health plan. It was 4.3% and the national average was 5%. So we're a little bit lower than that goal, and we want to move that needle. So some cost data that is new. This was released in our end of year report done by our group health insurance board. And so this is really, we're always a year behind because the data lags as it's flowing in. So in 2014, the prevalence of chronic conditions and this is true health plan data, is per 1,000 members, we have 102.3. And we're in the blue. And then our benchmark of state government is in the reddish color, and the green is the public sector. I'm sorry, I said that wrong. The red is the public sector and then the private sector. So you can see that hypertension is number 1, diabetes number 2, osteoarthritis is number 3. The whole time that I've been with the health plan, these numbers stay about the same, but we're really working hard to move that needle on multiple avenues, but today focusing on diabetes. So what do? We decided, and I'll go through kind of the process, but right now, and what we decided to do is that we're going to cover the cost for those members who are at risk to go through a DPP class. They also get, and this is where it's very important to us, that our vendors work closely together. They are not supposed to be siloed. We need them working together. So Anthem is running the DPP program for us, and I'll talk a little bit more about that. But Humana Vitality is going to give these people points. So they're getting incentivized, not just keeping themselves from being diabetic, becoming diabetic, but also getting vitality points that can then be turned into vitality bucks, which can then you can go to the Amazon store. I know of people who get car parts, the car breaks down. You can go get an Amazon gift card and buy that car part. So we partner with Anthem, and I'm going to take a second. I saw this on the table back there, and I have to really call out Julie Brown. Okay, I couldn't help but grab this and bring it up here because we were kind of talking about that we needed to cheer Julie because she's done such a fantastic job for us. I'm gonna go through kind of the process that got us to where we are, but right now what we're doing is we're partnering with Anthem. And I'll tell you that this DPP program for health insurance carriers is not exactly something you do every day. So when we told Anthem, we had already been doing this, so we told Anthem that, you know, when they won our contract in 2015, that they had to do this. And they kind of had, sorry, Anthem folks back there, a bit of a deer in the headlight look. It's like, you want us to do what? And we're gonna do what? So they have been awesome, and they assigned Julie Brown to this, and she is really behind the success of the program as we're moving forward. She's done a fantastic job. So Anthem is really using, and Julie came up with this process. They're looking at the 4 R's. Sorry, that must have been a Kentucky accent coming out. Recruitment, referrals, reporting, and reimbursement. In recruitment, Julie Brown is set up outside this hall. She has a table. If you want to become a DPP provider for us, she's ready to set you up back there today. You don't even have to go anywhere. Just go back. That sales table is back there, and you can become one of our DPP providers. But let's talk about how we got to where we are today real quickly. So in 2013, we piloted, Humana was our medical TPA at that time. We piloted a program at King's Daughter Medical Center in Ashland. Did I hear someone from King's Daughter? Thank you. In 2013, what we did was provided free of charge through a CDC grant, the DPP program. And then also we had some local YMCAs offering free membership for participants. And then you can see the results. That first group of people lost 5 to 7% of body weight and increased their physical activity to 150 minutes a week. So the average attendance, 94%. That's fantastic for a 6-week program. I don't even think some college professors can get that high sometimes. Average weight loss, 23 pounds. Average physical activity, 168.5 minutes a week. So you can see the program was very successful. And we thought about that and we're like, well, why wouldn't we do this? If we can pay for this course at about $400 to $500, or it'll vary based on provider, why would we not do this for our members? Because if they become diabetic, it's not only troubling for them and their family, and as they get older, it gets worse and worse for them and their family, but it also saves us money. So we decided to make it a paid benefit in 2014. In 2013, you can see Boyd County was our first location. And then in 2014, and we were working with the Anthem nurses. During this point, you can see we had 31 individual DPP classes, 201 KEHP members were referred, and 113 KEHP members participated. Okay, when you have 174,000 members, and you have about 24,000 of those who are pre-diabetic, this number doesn't sound very big, does it? But it's kind of like, have you ever heard that story of the starfish being thrown back into the water? You know, the little boy is walking down the beach, and an older gentleman is watching him, and he's picking up a starfish, so the tide is going out, and there's all these starfish laying down. And he's picking up these starfish, and he's throwing them. And the older gentleman, who was no relation, just someone walking down the beach, said, "What are you doing?" And he said, "I'm throwing the starfish back." You know, he didn't want them to get burnt up on the sand. You know, they needed to get back in the water. And the guy was like, "Well, why would you do that? There's millions of them out here. You're not making a difference." And so he took another starfish, the little boy did. You know, we learn so much from children. And he took that starfish and he threw it back in the water, and he said, "I made a difference to that starfish." So maybe these are not huge numbers, but we made a difference to those people who participated in the class. So much so that 56% of them actively engaged of the ones who verbally agreed. And you can see from the map, we're growing. This is in 2014. Now we have more providers. In 2015, this is when Anthem came on board, and they did that deer in the headlight look, but they didn't keep it for long. They partnered and had conversations with the folks from Humana who did this program for us. They partnered, they researched. Julie went out on her own. She dug her heels in. This is kind of the flag again for Julie. But you can see that we had 511 KEHP members referred as of December, and 375 of those were actively participating. So again, we're making a difference, maybe not in huge numbers, but to each one of these people, we are making a difference for them. And you can see the chart is growing. You guys know what it looks like today, so this is just a little bit of history. Some results. So out of those 375 members, this is the 2015 data, total weight loss more than 3,000 pounds, 8.9 pounds average, total physical activity 46,000, almost 45,000 minutes, 125 minutes cumulative average physical activity. The key number and the number that we're really going to start working toward is the A1C number, because we know that A1C number is going to give us a better feel on, feel's not the right word, a better metric on how these people are really doing. So in 2015, we moved the needle from 6.15 to 5.69. And that's a huge drop in an A1C for a person, keeping them away from being diabetic. And that's the number, the team that we've been discussing, that's the number we really want to, even though we'll keep looking at those other numbers, the more A1C numbers we can get, the better we're going to be able to sell the ROI. Some data through October 2015. So we had 307 members at risk. We had 17,629 members with type 2 diabetes. We spent $125,000 on those 307 members. We spent $6 million on those other members. If you look at $34 per participant per month on the folks with diabetes, that's what it's costing us. It's costing us $356 paid amount per claimant. And that's an ongoing figure. The DPP number is for that class that member is in. So that's the cost of the class per participant, breaking it down. And if you take that out for a few years as people continue to grow and they don't do anything about their health, then you can understand why we have this model. Here are some testimonials. Here are these starfish that we made a difference with. So Connie, it saved her life. She had an uncle who had both legs removed due to diabetes, and she was able to see that his lifestyle choices were leading her down the wrong path. Tired of being tired. Have any of you said that? Sometimes you just get that way. I'm tired of being tired. And that's what helped her, motivate her when she got the trigger call from a nurse to say, I'm going to be in this program. So this program gave her the tools to track her food choices and increase her activity. So those of you who are DPP providers out there, this probably sounds familiar, doesn't it? And how awesome that we get, this is the human side, that we get to see what the human side results are from this program. And we know we have a lot of members. I mean, we have folks bus drivers, cafeteria workers, park wait staff, park janitorial service. They don't make a lot of money, and many of them are working for benefits. So being able to have this program paid for really truly is a lifesaver for them, because there's no way that they could make that choice between food and a DPP program. The choice is obvious, they're going to pay for food. So if we can pay for this for them and then help them understand how to pick the right food choices that they can't afford, then we're doing better by them. My father was one of these folks that made the wrong choices and died very young because of his diabetes, but it was related to his choices. And that's the thing that people have to remember, is that it's the choices in these DPP classes that you're providing and that we're paying for makes a difference for those members. So the future, look at the map now. And it's great that Dr. White carries this around. I'm very impressed about that. That's amazing. Julie said that she carries it around also. But this is kind of our guide for the future. We've got some gray areas that I know Julie's going to fill in with numbers. But January and February, So we had 159, this is just this year, between January and February, we had 159 members agreed to talk to a nurse. 38 of those members were referred and given specific class information. And we had 67 members reported as actively participating in January, February classes. And then these are confirmed enrollments just since the first of the year. So you can see we already have a lot of classes, and we have a lot of on-site classes. Kudos to the Cabinet for Health and Family Services. They've had multiple worksite classes. I said on-site, I really meant worksite. They've had multiple worksite classes. The Personnel Cabinet is getting ready to start its second worksite location class. And because the Personnel Cabinet is partnering or sharing a building with revenue, those members also participate in that class. But you can see we're only into March, and we're already making headway with the classes. And in March, we have 23 classes coming up, 5 so far from April, and I think when Julie gave me this data, there was still time for folks to sign up for April, so this number could have changed a little bit. So the continued partnership, we mentioned the diabetes report. We're going to continue with that. We can talk about, as we're looking at that diabetes report, is there, what else can we do? Do we also need to turn our attention to folks who are already diabetic, helping them maintain their disease and manage that disease as if they already have diabetes? But we have a lot of things that we're trying to work on as a health plan. We have, as you saw, osteoarthritis, and all those kinds of things are issues for our members. So we do a lot of different things, but I'm probably most proud of our partnership with our vendors in doing things like DPP in our communities. We also this year, because we recognize the need for this, and this program literally brought people to tears during open enrollment, that we have a value benefit that has reduced copays for members for their diabetic medicines. Supplies are covered at 100%. I can't imagine that we won't do that again in 2017. So we constantly are looking at these kinds of things, and again, it goes back to how do we make a difference for our members? Any questions? I'm not sure, I may have gone too fast because I know lunch is next. I didn't go too fast. What questions do you have, if any? Yes, sir.
Is there any interest in actually looking at this data over time? I mean, you can see, here are the people that are in the program and here are the people that aren't. You'd have to build some kind of a design that allows you to have some kind of a control group or something. Have you looked to some university or somebody to work on that task? That would really be helpful.
You're right, it would. We have a partnership with Aon as our actuarial group, and also with Truven, who does our claims data warehousing. And so the information on members is being sent to Truven. They get all claims data. We stay away from individual claims data. We don't see any of that. So we get reports from Truven. I think that we would be able to, I don't know about having, well, no, we could, because they have all the data. That is something that we really do want to look at as we continue to grow this. We need to be able to look, to your point, and see, are we making a difference? Some of the numbers, and Jan and Sunny, you might help me here, that we just looked at Tuesday from Anthem, just on the medical side, no pharmacy benefits yet. But in going back through, and I even was working with someone last night going back through that data again, it looked like some of the diabetic numbers were just a little lower than they had been, but I cannot say any correlation yet. So we really do have to kind of look at that and see what is going on, and we really do want to do that. Even as I was putting this slide together, that was part of my thought. I wish I had a little bit stronger ROI, but the data is so new that we will get there. So very good question, thank you. Oh, yes, ma'am.
I'm wondering about follow-up in a year to two to see if the folks are still got their weight off and these kind of things. Is this up to the programs that are providing it, or is there someone from the state that will be looking at some of this information?
I don't know that the state is able to do it at this point. Any of the providers in the room, do you have a way to follow up? I'll see what I can do to get an answer back to you on that, because that is a very good question. So that we can, if you're looking at the data and the numbers are going down, you're thinking that, okay, you're making that difference, but how many people fall off the wagon, if you will? I think that's basically your question, and a very good question.
And a lot of our counties have health diabetes coalitions or support groups and things, and we can align so that they're transferring over to that to get continued help, because we know that it's continual.
And I know I said earlier it's a 6-week program. That's misleading. It's really 8 months, because you do the 6 weeks and then you go 16. Thank you. And then you continue to go at a lighter or less frequency. So when you look at changing behavior, when you're doing it for that long, they say to break a habit, how many weeks does it take? So really that's getting people to break the habit. But that is a good question. Yes, sir.
I'd like to ask you a non-diabetes related question that you may not be able to answer. What?
Okay.
My understanding is that the governor's budget has taken $500 million out of the Employee Health Trust Fund.
Yes, sir.
Is that true?
Yes, sir, but let me answer it this way. The way the statutes are written with our trust fund, every year stands alone. So when we closed out 14 and we're looking at 15, we had some surplus monies. And we're going to have a fairly large surplus in 15 thanks to our relationship with our new vendors, CVS and Anthem, because of the network that they have of providers and the cost that they have. That surplus may be $200 million, $250 million. I don't have the final numbers yet. What the governor is saying in his budget, we cannot use that surplus to pay down premiums for the next year. And that's in statute. Every plan year has to stand alone, and we're not allowed to use it. In the past, and actually there's still a $63 million, and I'm being non-political here, I'm giving you facts. There's a $63 million amount that has to come out of our trust fund from 2014 to go into the general fund based on the last biennium budget. It went into the general fund. What the governor is saying is any of that surplus that we have, he's not going to allow that to go into the general trust fund. What he's going to do is put that in a fund that is specific to public employees. Now, it's specific to the retirement plans of public employees, but instead of going into the general fund, it's going into a fund that will only benefit public employees. And in the last 4 or 5 years, we've had over $200 million taken out of the trust and put in the general fund at different times. So all he's saying, and that number sounds really high, doesn't it? But we've had some good years. That doesn't mean those good years are going to continue, because as I look with our actuaries down the road, we need to really make sure we're doing things well to take care of our members, get them well, so we can keep down premium costs. Does that answer your question? Because that is a true statement.
Why don't we just pay less, and then you won't have that surplus?
Very good question. Sometimes it's hard to predict exactly what that premium is going to be. When you say pay less, you're meaning pay less by employer and employee premium. Yes.
Well, this year, the employee premium did not go up.
We have not had employee premium increases in 2 years. That's unheard of. So we are doing our best to take, thank you, Dr. White. And on top of that, we've been able to still do programs like DPP, the diabetes value benefit. So we do try to do as much as we can for our members. And not having increases for premiums in 2 years is truly unheard of. So we really are good stewards of that trust fund. Yes, sir.
It's exciting to see you go from around 100 participating in 2014 to about 400 next year. Do you have a sense of what your goals are for how many will participate over the next few years, and what might be some key challenges to getting to those numbers?
Very good point. I think, right now we're already at, I have to go back and look at my number myself. Those are the classes. I thought I had the number. So 67 in the first 2 months. It would be good, I think, to double the number that we had in 2015. Got that, Julie? And I think we can do it as a team. I mean, we have to keep continuing to pull people in. And I think, when you look at the map, you guys are extremely important to helping us meet these numbers and doubling it, because Anthem is doing a fantastic job. What happens, and we're also promoting it at a bunch of events. So many things tie together. So we have the Living Well plan, the Living Well promise. I didn't really go into that. But to do the Living Well promise, or meet your Living Well promise, you have to do a biometric screening or complete a health assessment. Julie's at a lot of those events. Or if someone at those events obviously has high glucose on the biometric screening, we're pushing them toward the nurses who can help locate a class for them. So the noise about DPP is really moving fast, and I think that's a good thing, and that's going to help us meet the numbers. Anthem can't do it by themselves, KEHP can't do it by themselves, but the partnership that we're building, that's why I'm here at the KDN, not just to tell the good story about what we're doing at the KEHP. I'm very proud to belong to a health plan that does that. But at the same time, we can't do it by ourselves. You are the folks that help us make it happen. And down the road, I would like to see us, and I can't make promises yet because I haven't done any actuarial numbers, but that we do the same thing. This came up in the last meeting with Dr. White and her team, looking at the annual report, is can we do something more along the lines of helping people maintain their diabetes? What's the class, Dr. White? The DSME, thank you. The DSME, is there something we can do to help support that? And I can't guarantee that yet because we need to look at numbers, but that, we need to keep building on this. So very good question, thank you.
Pay for it.
Right, and that's what I'm saying. That's what I'm saying, and that's where we have to look at the numbers. Can we afford to pay for it? And we would like to, but that's Jenny's heart talking. That's not the actuarial pocketbook for the trust fund. And that is a very important part of our business. Yes, ma'am.
I just wanted to say a quick plug for what she's talking about. When you have the state insurance, you have Humana Vitality, and you can get incentives like Jenny was saying, you can get Amazon gift cards by getting your steps in. But I also explain to people, because not very many people participate in this, but it's things that we're doing already. We get points for our vision test. We get points for getting your dental, your teeth cleaned twice a year. We get points from the mammogram. My hubby gets points for his prostate, colonoscopy. But you get points for things that we're already doing, and it's free. And I've gotten a laptop, and really the best thing that my hubby liked was we had a tractor and it had a leak on the tire. We got slime. That's his best thing we got today.
You got what? My husband owns 2 tractors. What do I need?
But like I said, we just got done ordering a laptop, and it's free. But people don't take advantage. And you can call Humana Vitality, and they'll help walk you through it. If you have any questions, all those operators are so nice, especially when I first started doing it. But again, it's things that we're already doing, and you're getting points. And the health assessment, you can either do the health assessment or the Humana Vitality screen. And the health assessment, it's just questions you're just plugging in. just different questions. If you know your blood pressure, fine. If you know your cholesterol, fine. But you can just say, I don't know. And then you get points. I always tell people you get points for being within range. And then you can do things, if you're not in range, you can do things to get points to get you back in range. So, and I like that with the DPP, that you're going to give points for
Yes.
that. So,
Yes.
but it's a good program.
Thank you so much. What a great testimonial. It is a good program, and you know, if you need any help with Humana Vitality or any of our products, you can call our vendors, you can call our staff. We'll walk you through it. Yes, ma'am.
On Kelly's question, how many total participants do you all have, and how many has participated in the health screening or the health assessment? Did I miss that?
Well, I didn't really talk about the numbers for the health assessment or the health screening. For the Living Well Promise this year, we're already at 51,000 who have completed one or the other. And then, let me see if I can remember off the top
How
of
many total participants do you all have that would
who need to do the Living Well Promise, about 137,000. 132,000, sorry. 132,000 have elected a Living Well plan, either a Living Well CDHP or a Living Well PPO. And then we have a standard CDHP and a standard PPO. If you don't complete your promise, you have to take those standard plans the next year. They're all good plans. The richer plans, of course, are the Living Well plans. The last 2 years, when we've done the Living Well Promise, we had 97.5% complete their Living Well Promise. And we're looking at making sure that, you know, I can't let Joe outdo me. He may have gone on to other things, but we've got to keep these good things going. So we still are looking for 97% this year, and we're well on our way, because I look every week now that I'm getting those numbers, I go back and I look at last year. Are we where we were last year? And we're right on target.
Can we go back to that one slide back, please? It was the number slide, the 159, 38, 67.
Oh, I think it's going the wrong way.
There we go. So, do these numbers correlate with each other? I mean, is it 159 members agreed to talk to a nurse and 38 of the 159, or are these separate numbers?
I think the 38, Julie, correct me if I'm wrong, I'm using Julie's numbers. The 38 is not exactly a bucket of the 159, is it?
Well, we have a really wonderful outreach program that's available to the DPPs. Those of you that get me your class schedules, we actually are able to attach the zip code of your class schedule to the zip code of members that trigger for being at risk for diabetes. So once we've actually attached those people, then we do outreach. And through our outreach process, during this time period, since the first of the year, there were 159 members that agreed to talk to one of our nurses. And we have 39 dedicated nurses that are completely dedicated to the Kentucky Employees Health Plan. Of the 159 members that agreed to talk to a nurse, 38 of them actually requested information about a DPP class, and our nurses provided them with specific information about a class that is going on in their specific area. So, even though 38 requested specific information and we gave specific information to them, there's still a handful of those other people out there are still contemplating, they know they're at risk for diabetes, so they may call back in and talk to our nurses about, hey, last month wasn't good for me, can you tell me about some upcoming classes? So that's how they relate. And of the 38 people, what's reported to me from the lifestyle coaches is 67 members as of the first of the year are currently participating in classes throughout Kentucky.
So Julie, those 67 could have been members who were referred last year.
They could have been referred last year.
That's why the number's higher than the 38.
Exactly.
Yeah.
Or I could have been working a health fair and someone came past and shared with me that they had recently been diagnosed with diabetes or pre-diabetes, or they were at risk for pre-diabetes, and then I see them as a good candidate to give them information about classes going on in their community.
Thank
so
you.
it could come from that.
Julie, that's really remarkable, and we do Humana Vitality, Tara and I, and see a lot of the people with that are in the pre-diabetes range, but we also see a lot of people that are actually in the diabetes range. So, I mean, is there a mechanism to refer those people in a zip code area to classes?
Well, we have our nurses that are completely dedicated to the Kentucky Employees Health Plan are dedicated to supporting all the clinical programs.
Okay.
So if there is an opportunity, even when I'm working at health fair, if someone shares with me that they're not pre-diabetic, but they are diabetic, it triggers me to talk to them about our diabetes program. And we've got some great benefits available, as Jenny mentioned, to our diabetes clientele, to our diabetes members.
And I was just going to say real quick, you know, Julie's mentioned the nurses quite often. The relationship and the partnership that we have with Anthem, they do have a nurse program for us. We have a nurse line that's open 24/7. We jokingly wondered if we were even going to keep it because we weren't sure how many people would use it. We've got a lot of people using it. I've just seen the statistics. You know, they have case management, utilization management. So, you know, if they, future moms, so I can't name all of them, but we have all these fantastic programs that people can have for free, you know, talking to a nurse, and they'll engage with you. They'll email you whatever you want. So a lot of times nurses will reach out based on a trigger of a claim or biometric screening that says this person has been diagnosed with hypertension. What can I do to reach out and partner? We even have with Anthem, they have a pharmacist who coordinates with CVS's lead pharmacist, and this is amazing because these guys are competitors too. But they're working very well together, and we greatly appreciate that. So Anthem's pharmacist may see something on a claim that's a little worrisome based on pharmacy information that's coming in. So before CVS might even have a chance to know about it from the medical side, their pharmacist is calling CVS's pharmacist and intervening and making things right so that you don't have any drug interactions and those kinds of things. So DPP is fabulous. It's an important program, and we're glad to pay for it. But we also have so much more for our members. Please share with people that they need to go to the anthem.com website for KHP. They can go to the khp.ky.gov website, and we have links to all of our vendors. These nursing programs, utilization management, case management, all those things are amazing, and they work for our members. Yes, ma'am.
Do you know of a number, I don't know if you know this or not, of the number of people that want to do it again? Like, are you tracking that at all? Because I know in our DPP programs, we have several people that just want to do it again. They may be at a higher weight, 250, they've gotten their weight down, they've lost their 7% to 10%, but they still have to do more. And this program provides kind of, I know somebody asked about support and stuff. Also provides a support besides the monthly support groups.
I think we're starting to hear a little bit of that, and I think, you know, this is where the business side of the health plan has to come in, is how many of those can we afford to pay for? You know, we've had just initial discussion about that, and we do need to look at that. And we have some other programs that people might want to repeat, but we really have to kind of, we have to wear our fiscal hat on this and see, is this something that we can support? Is there another way we can try to help support? Because we do want to provide the support, but, you know, and sometimes things don't take, do they? You know, and people may need that next visit or next time, and so we are in discussions about what would the right number be, the right thing for the plan. Good question. Yes, sir.
Yeah, I just want to make a comment. There's a bigger movement that's occurring, and I'm going to ask Teresa just to make some comments to this, that other employers are starting to cover DPP as a benefit. Anthem for their employees, there's a lot of them in the state of Kentucky, but outside the state of Kentucky is where the bigger pie starts to occur. You start spreading into other states. Humana's covering it, LG&E is now covering it as a benefit. Jenny was gracious to come to our employer coalition meeting to present the DPP in order to sell these employers to start covering it as a benefit. Because as we start getting the payers and employers to start covering it, then we'll go into the bigger pie of buckets or, you know, huge numbers of patients within communities that are doing it. So one of the good things we can do through KDN is educate our local employers. If you have staff people that work for an employer and they know that LG&E and other employers are now covering it as a benefit, you know, and this is being supported through the CDC and Dr. Light's team and now through KEHP, we have the ability to start influence on a local level statewide. But the big picture, and I'll ask Teresa, is we're starting to get calls from other states and other large employee health plans like California. Teresa, and by the way, Teresa presented, we were one of 4 states in the country on a CDC phone call, which essentially was every state in the country, that we presented our DPP program as a best practice for others to model off of. So Teresa, you want to make a comment to that?
Thank you, Jim. Yeah, we've had a number of opportunities to present to national groups, and in fact, Matt's over there. I haven't had a chance to meet you yet. But one of the latest ones that AADE and CDC have contractors kind of working on just trying to, as this DPP thing is new and it grows, and they're trying to kind of collect some best practices, trying to find out what works, trying to be able to share that with other folks. And so we've had the opportunity to talk a lot about this and are still continuing to talk about it. And obviously it's not us, it's all of us, and it's Anthem has been working with us on that. Julie's getting ready to present also on an upcoming webinar that we're doing. And you know, all of the players are important, as you heard what Jenny Goins is saying, that, you know, there's so many of the pieces that have to come together to make this work. And so we try to make sure that all of that is highlighted, because it's not any one agency or group of us that's making this work in Kentucky, but I think it's the fact that we have organizations like KDN and have networks here that are built that we work well together. So I think that just helps move things like this along. But we have had the opportunity to be highlighted and highlight all of your work in Kentucky several times, and are still continuing to get requests for that. So, and you know, kudos for you guys, and thank you all for giving us such great things to talk about.
Yeah, and Janice Hale was not able to make it here, and she's my duly number 2. I'll take the red. She essentially spends hours and hours with our Connection newsletter, which is just an absolutely incredible document quarterly that I use a lot with Bob to get to the hands of the legislators so they are better knowledgeable of what goes on. But you know, Janice has had a call, and she's working intimately now with the state of California. They want to cover DPP in their state employees of the state of California, 1.4 million covered lives with DPP. And if they do in California, we are assuming that a lot of states are going to start saying, we need to do it too. So this is a large scale. It's just something simple on coordination and collaboration. Jenny was asked to go down to the National Salvo meeting to present to these mega employees similar to the Commonwealth of Kentucky, where I think there's 80% of the state employees throughout the country are going to be there presenting the diabetes prevention program as a coordinated collaborative effort of what we've done and modeled in Kentucky for other states to do. And the last thing is, you know, I'm on the board for the American Diabetes Association, and Gary is our regional director, and Sue is one of our executive members. But we were able to get Humana Vitality to improve points for all of the ADA activities that are done in our communities. So when you go and do the Step Out Walk, or you do the Tour de Cure that we host in Louisville, you're eligible for Humana Vitality points. So that's just it's a couple of simple ways of, as we start doing things together and throwing incentives to our community, we're going to involve that community and push that community and members and more members to understand and be aware of diabetes, but more importantly, get involved. So thank you.
Thank you.
KDN, I'd like to present you with a so much. And we'd like to present you with this plaque for the outstanding leadership and support that you all have with the diabetes prevention program. So thank you so much.